Hello and welcome to the CCO podcast. I'm your host, Zachary Schwartz. In this episode, we look at partnering with patients for PBC care. We'll explore actionable strategies for healthcare providers. To explore this, I'm joined by Dr. Gideon Hirschfield at University of Toronto and patient advocate Jess Schnur. To learn more about them and this program, see the show notes. But for now, let's listen in.
Hello, my name is Gideon Hirschfield. I am a hepatologist based in Toronto, and I direct the Autoimmune and Rare Liver Disease program at Toronto General Hospital. We have a great investment in people living with primary biliary cholangitis, and today we are having a podcast conversation with a patient with primary biliary cholangitis, looking to learn about this disease from a patient perspective and how listening to what happens to our patients can lead to better care and actionable items for healthcare professionals to incorporate into their expert patient care. With me today is Jessica Schnur.
Thank you so much for having me. My name is Jessica Schnur. I'm from Evansville, Indiana, and I am a registered nurse. I worked CVICU right away from graduation, and within about 2 years of working there, I ended up diagnosed with PBC. So I went from being the nurse to the patient in the bed, and over the course of 11 years, I ended up having a liver transplant that was done in 2021. And really, since my diagnosis, I've really worked on being a patient advocate. There was so much information that was outdated when I was diagnosed that I just really jumped into what can we find out? Who do I really need to talk to figure out the best way to plan a treatment or to make my treatment plan? And how can I help others that are having the same question?
When you're told you got PBC, what sort of things go through your mind that you'd like to cover at a high level? Okay, not everything, that you'd now try and tell some of the patients as you're advocating with them to expect to hear from their healthcare provider.
Once you've gotten that diagnosis, I think what runs through everybody's head, and what I see a lot of questions on from other patients is, does this mean I'm going to die? Do I need a liver transplant? How soon will I need that transplant? And what does it mean for my life? How's the fatigue that we were normally experiencing before diagnosis and the itching? What can we do to fix it? Is there a cure, or are we just treating things?
Exactly. I mean, so what I normally go through is I say, okay, you've done nothing wrong. It's a disease of genes and environment. It's the immune system attacking your small bile ducts. It is what it is. And then I say, but there's lots I can do. I can treat the disease, help you with the symptoms, prevent progression of liver disease if I understand what your risk is, help you have a better quality of life, okay, just because you got PBC. Because we know many people are scared of liver disease. And the minute the primary care hears you got liver disease, it's like, well, you can't have this, you can't have that, you can't have this. And mostly it's not correct. You can have statins. You can take Tylenol as long as you do it carefully. And you may need menopausal symptoms treating, etc., etc. And it's not a no. It's do it in this way and move on. And I wonder whether you think that kind of approach is a sort of actionable item again for healthcare providers when they think about patient-centered care.
That is, I think, one of the top things we have to talk about is, how is this affecting how we're taking care of things in the rest of my life? Because what can we take over the counter? Are there foods I need to avoid? And let's face it, you get a fever when the doctor's office is closed. You get the stomach bug when the doctor's office is closed. So then you're panicking. And if you're in a rural area, even the ER doctors, the physicians there, they've never heard of PBC. I've heard so many doctors behind closed doors where they're like, what is this that she has? Oh, it's cirrhosis. It's something she drank too much. And I've heard then somebody else pipe up and say, oh, no, that's not what this is at all. So if you go in as an informed patient, number one, it's going to keep you from having any bad interactions or reactions to any kind of treatment if it's for an infection or something like that. But then it will also, I think, inform other providers that you see. I have so many doctors that reach out to me now and they're like, oh, I have a patient that has this. I gave them your name. Hope that's okay, because they have questions and I don't really know anything about it. So the more you talk about it, and the more it can end up helping your entire healthcare system, because once one doctor hears it, they kind of trickle it down to others.
So we always signpost towards a patient support group, be that American Liver Foundation, PBCers, your local,
Yeah.
different PBC chapter or liver chapter, because that's a great starting point. Then they can get some very simple education, about the disease, about the treatment options, first line treatment, second line treatments, symptom treatments, when do you need a transplant? But you can also get very practical advice, like you just said, you can take Tylenol unless your liver's not is very poorly, and that's actually quite unusual in PBC. You may want to take some Advil every now and then. It's quite possible, and it probably is okay for lots of patients, so long as you understand. There isn't a specific diet, but being healthy is a good idea. There may be things you need to do about your bone health, and there may be things around menopausal symptoms. There may be things around contraception. There may be things around high cholesterol. And we try and sort of signpost in advance with a little bit of confidence that it's going to be okay to have those questions. It's okay to answer them. And there are actually generally, for most people, because we can treat the disease so much better than we used to, very good plans. And most people are actually having the same care as everyone else. So long as you say, Jessica, we make sure that their doctors and their nurse practitioners are not scared of PBC because they haven't seen a lot of it. And actually, if you work with the patient's a bit of an expert. The patient support groups are experts. The doctor feels more supported. The patient feels more supported. And ultimately, you get the medical bit right, but you also get the social medicine bit right as well.
Right.
One thing I wanted to get you to explore is some of your thoughts around symptoms. Okay, so I know how to treat PBC. I can educate most healthcare providers. UDCA is the first line treatment. Then we have 3 approved drugs, obeticholic acid, elafibranor, seladelpar. But actually, whilst that's really important, and we know we're doing a great job, and we've got more coming, one hopes, what about living with the symptoms of PBC and how healthcare providers might kind of listen and how patients may just advocate a little bit more about it?
I really think for PBC patients, the symptoms are so much bigger than having just the PBC diagnosis, because that itching, the fatigue, it affects your life every single day. You're not sleeping well. You're still trying to take care of your house and your family, and you're tired. So having a provider that actually steps back and says, okay, we've talked about the treatments, we've talked about the labs, but we really need to talk about what's affecting you. And having a provider that, at the end of the visit, shut down that computer and says, none of that matters right now. Let's talk about you and how it affects you. That gives me so much trust in that provider. And I've been hearing it more from some of the other patients. They're like, it's so nice when they're like, how's your fatigue? Like, how well do you think you're sleeping? And from a patient side, I always recommend to keep track of your symptoms. Is my fatigue worse in the summertime when it's hot, or when I do certain things? Is the itching worse if I'm eating certain things? And if you take that picture into the doctor, that helps them formulate a care plan, because medicine is science and you need numbers and some data right in front of you. So keeping good track of your symptoms and what makes it better and worse can end up helping your general healthcare overall and make you feel satisfied with your plan, which is going to make the patients happier with their care team. And we won't see so many negative comments about care teams online, and hopefully more positive thoughts. There's been some neat apps put up by some of the various pharmaceutical companies to help you kind of document your itch. And you can mark, was it on my hands or my back, or would I rate it on a 0 to 10 scale? So I think asking your doctor or even your healthcare provider providing, like, here's our plan. You tell me where your itch is on this scale so that we can keep track of it at your visit. And same with the fatigue. So addressing that, because those are the 2 hot button items that we hear the patients talk about the most, and we hear concerns about in the support groups. How bad does the fatigue get? How bad does the itching get? What makes it better or worse? And something else that I think is interesting is a lot of patients describe it as flare-ups. So they'll see where the itching and fatigue is worse. So having your healthcare team kind of address that. Are there things I should do when I really feel like it? I've been tired. It's a 10 out of 10 tired for the last 5 days. I'm, scratching my leg so much that they're bleeding now. How do we address that? And I think that kind of helps also you trust your healthcare provider, because they're aware of how bad it can get. And a lot of times maybe they don't see that, but they're not the ones experiencing it.
Yeah, I think that's great advice. And remember, I think as a provider, you shouldn't feel threatened because you can't answer all of the questions or you can't address all of the symptoms. In fact, in my experience, the majority of patients understand that, but just feel better having had the chance to say it, explain it, and maybe show it. Now, and that in its own right is often enough. It's not perfect, and the patient may wish to have less fatigue, for example, but just having had the opportunity to talk about it, perhaps quantify it, put it into context, can actually help the patient. So I don't think the doctor should feel sort of nihilistic because they can't solve everything about fatigue. Exercise helps fatigue, making sure you're not anemic helps fatigue, trying to make sure you're on the best treatment can help fatigue. But often we all know that we're not going to get rid of all of the symptoms associated with PBC. Itch we're really good at. And, we've got lots of options for itch. But I just think it's the opportunity that the patient feels able to ask. And we've heard that, and every doctor does it differently. And it's really hard in a busy clinic where everything's on the computer. We're all stuck to our screen on Epic to try and put the computer away and just sort of listen a bit. It's not easy. We can always all do better. It's often, you're going to look after these patients a long time. So it doesn't have to be perfect every time. That's the other thing I think I tell clinicians is, okay, so some visits will have to be quicker. You've got some other patients who are too sick and you really have to divide up your day. Whereas other times you'll see the patient have a bit more time to focus on these things. And I don't know what you think, Jessica. My experience is patients understand that and are generally quite reasonable and are happy with that mosaic approach.
Oh, definitely. And as a patient, you're like, okay, I'm going to go in. We're just going to have a quick chat. I saw my labs already because I had them prepared before the visit. I know my few questions, and then we can get on with our day. So It really just improves everybody's view on the care plan.
Exactly. Some visits are quick and short to the point. Other visits, you want your patients to just at least allude to what's on their pressing issue. And even if the doctor doesn't solve everything, I think everyone feels like you've tried.
I think as a PBC patient, our whole lives have just changed. We've got this diagnosis, these 3 letters that we never really knew anything about before. And as it's a chronic disease, it's affecting our daily lives. We know there's not a cure. So having a healthcare provider that is aware of how much that affects us and that we're going home and we're living this every day and seeing what we could do just to make some simple improvements. We may not totally fix everything, but ways to work on the fatigue, the itch, being able to understand our lab can just really turn our days around where we're not stressing and making ourselves more sick because we're so hyper-focused on the PBC and this is what my lab is. So it's a team approach and you have to keep that team mentality. And if you have a doctor that's actually listening to you and is concerned about your symptoms, that's going to make a world of difference.
Yeah, and I'd say that from a healthcare provider point of view, watch this space. PBC is moving fast. Treatment options are improving. Better treatments will prevent end-stage liver disease and will treat symptoms better. And actually, there's a lot you can do for your patients, both medically in terms of, medicines, but there's a lot of things that Jessica's highlighted, which really highlight some of the supportive care that can make a real difference.
You've been listening to Gideon Hirschfield and Jess Schnur. To learn more from this program, click the links in the show notes. And to hear more podcasts like this, be sure to subscribe to the CCO podcast channel on your favorite player. Thank you, and we'll see you on the next podcast soon.